Thank you. Good afternoon, everyone. Welcome. This is the Indigenous and Northern Affairs Committee of the House of Commons. Today we are continuing our study of Indigenous suicide and suicide in Indigenous communities. We also have the Minister of Health with us, who's going to be speaking with us both on her mandate letter and on the suicide study itself. So two purposes. And joining her today are, Sunny Perron and Simon Kennedy from the Department of Health. And this will be the first hour of the committee meeting. And Minister Philpott, I think you probably have seen such devices as yellow and red cards before. So I'm happy right now to give you the floor for 10 minutes. And at 9 minutes, I'll show you a yellow and at 10 a red. And please feel free to share the time in any way that you would see fit. And then there is a second panel with NWAC in the second hour as well, and we'll have a brief recess between. So without any further discussion, I'm happy to give you the floor. Thank you.
Merci beaucoup et bon après-midi.
Thank you very much, and good afternoon to everyone. I'm extremely happy to be here with you this afternoon.
And the members for the invitation to come and spend some time with you this afternoon. I want to thank my officials who have joined me here today. The work that you're doing in this committee, the importance of it for Canadians can't be overestimated, and I want to thank you for taking on, in particular, this very serious study that you've been undertaking, and I very much look forward to hearing the results of all of the hard work that you've been doing over these past number of weeks. I think I'll start my comments related to the fact that you have been undertaking a study on suicide in Indigenous communities, and I think it would be fitting to express first my recognition and my condolences to the families who have been and the communities who have been most seriously affected by this issue, who have lost family members and friends and community members to suicide. And they need to be at the forefront of our minds as we have this conversation. I am sure
I beg your pardon, Minister. The bells are now ringing, so I just would need to ask committee members for unanimous consent to proceed for a few more minutes. It's a 30-minute bell.
Yeah.
So we can get through your presentation at least if we have unanimous consent for that. Okay. Yeah. Sorry for the interruption. Please proceed.
Thank you. So as I was saying, I wanted to express my condolences to the families and let it be known that, like you, these are the people who are on our minds as we have this conversation, and we've all been, I think, heartbroken by the tragedies that we've heard across the country in so many communities. I see the high rates of suicide in Indigenous communities, in particular, I think, affecting youth, but not entirely youth are affected. It's a public health crisis and therefore a very important part of my mandate. And I join you in the search for an appropriate response, knowing that no single person has all of the answers and we must work together on something like this. There are a number of issues of social inequity that form the basis of the challenges that I face in my portfolio in health. But I think when we look at social inequity in health and in mental health, the stark realities are nowhere more obvious than the challenges, the inequities that exist between Indigenous and non-Indigenous people. If we look at the matter of suicide in First Nations youth, I don't think that I need to remind the members here of the kinds of rates of suicide that take place where suicide rates between First Nations young people, for example, and their non-First Nations counterparts, whether it's on reserve or off reserve. And I brought with me lots of statistics, but I think you've probably heard lots of them before. And statistics sometimes, I think, confuse us, and it sometimes even takes us away from the fact that every single statistic represents a person that's a loved one and a family member and a community member. So I wanted to focus really on the fact that these disparities, the gaps in health outcomes, the tragic statistics that we read about have their roots in long-standing social inequity. And we can point to the causes. I'm not sure that we can say that we can find all of the causes, but I'm sure you've heard of what many of them are. Some of them are historical, many are ongoing. The roots of this crisis lie in colonialism, in racism, in assimilation, in residential schools, in intergenerational trauma, in poverty, and so many other issues. The ongoing causes behind the crisis include things like bullying that exists among young people, issues of low self-esteem, overcrowded housing, unemployment, lack of recreational activities. These are some of the reasons that I'm sure you've heard about at this committee as to why young people turn to self-harm and sometimes suicide. The traumatic impact of losing cultural practices, of losing the roots of communities, losing languages, disruption of family structures, disruption of social support networks all affect the health and well-being of those communities. And we find one of the most serious results being the high rates of suicide. I'm sure you've heard, I know you've heard many moving stories. I've heard many of them myself. I think about this summer when I spent time in Alberta visiting Treaty 6, 7, and 8. And in one of those communities, I met a bright young man. He was talking about his battle with addiction and the fact that earlier in his life he had attempted suicide 9 times. He became addicted to fentanyl, and getting treatment was very difficult for this young man, but eventually with the assistance of a clinic that was supported by his band, he got the treatment that he needed. He's now on Suboxone therapy and slowly decreasing his dosage of Suboxone. He's on a path to healing. He said to me, "I'm becoming a better father and a better person, and I want other people to know that there's a way out. I want people to know that we can overcome this." I am convinced that governments have an essential role in the strategies that we need to collectively gather to give hope and to give life to the ambitions of a young man like that. Change is going to only happen, though, when we work in partnership. That partnership has to, of course, include Indigenous leaders. It has to include every level of government and, of course, many sectors of society far beyond health. So my mandate includes making sure that I do work with Indigenous leaders. That includes the National Chief of the Assembly of First Nations, Perry Bellegarde. It includes the President of the ITK, Nathan Obed. It includes working with chiefs and council. Of course, I need to work with my provincial and territorial counterparts and multiple stakeholders to address health gaps that exist between Indigenous peoples and other Canadians. It requires, I believe, at its root for us to renew relationships in Canada, to ensure that relationships with Indigenous peoples are based on a recognition of rights, are based on respect and cooperation. And the healing process that I suspect you are finding your way toward as you have these conversations involves implementing the calls to action of the Truth and Reconciliation Commission. So what can government do? Well, much of what we are already doing has itself centered on righting some of those past wrongs, on addressing the long-standing challenges that have left this legacy of despair amongst young people. We, for example, are supporting an annual assessment of support for the National Aboriginal Youth Suicide Prevention Strategy. And this is a strategy that helps to reduce risk factors through a focus on prevention, outreach, education, and crisis response. We also have worked to support the National Native Alcohol and Drug Abuse Program, and this is another community-based program which includes residential inpatient treatment facilities. We're supporting mental health counseling services through the Non-Insured Health Benefits Program, through multidisciplinary mental wellness teams that are driven and designed by communities. We're supporting Indian Residential Schools Resolution Health Supports Program, which has been successful in providing support through some of the residential schools discussions, and it helps both former students and their families. And we're investing in research into mental health promotion and suicide prevention. Some of that's done through the Canadian Institutes for Health Research. It includes things like Pathways to Health Equity for Aboriginal peoples. It includes the Arctic Council Initiative. But we need to have new federal measures as well. I've been deeply troubled by the challenges that communities face as I have learned more about them, as communities face challenges in securing some of their basic necessities like housing and water and access to good education. And so, like all other parts of health, mental health needs go far beyond the provision of health care. It involves both looking at the causes and the consequences that have their deep roots and devastating effects on families and communities. So all levels of government, and I believe all departments of government, have a responsibility to look at the social determinants of health. Have I already reached a yellow? My gosh.
Yes, I'm sorry to say.
Okay. You know, I think that a lot of the things that I wanted to say are going to come out in the discussion. I think the biggest focus that I would want to say off the very top is that I come here very happy to share what our department is doing, and very pleased to be able to work with my colleagues at the First Nations and Inuit Health Branch, as well as the Public Health Agency of Canada. But I come here saying that I don't have all of the answers, and I look forward to learning, working with you, and where possible, responding to all of the good suggestions that I know will come out of this committee, and I very much look forward to responding to the questions that you have this afternoon.
Thank you very much, Minister Philpott, for your remarks. I'm just going to divert the conversation for a moment to managing the vote for a moment. So according to my math, the vote will be at 4:07. I expect most members will be happy to stay in the room till 10 minutes prior to that. Is that, can I just see if that's comfortable for people? So we'll have a recess at 3:57, which is in 10 minutes. The vote probably will take, with walking back and forth, about 15 minutes. We can be back here by 4:15. To continue on, the question is, is it the committee's pleasure to maintain our 5:30 end time and therefore shorten one of the panel's times, either the ministers or NWACS, or the alternative is, if I can draw your attention to one of our routine motions, which is around flexibility of end of meeting time when there are circumstances out of the committee's control, which is what the situation we're in today. We could simply stay beyond 5:30 the number of minutes that we lost for the vote, which would be about 15, would be what I expect. So let me phrase it as a question. Is our committee members willing to stay till 5:45 today to get through all of our witnesses in their fair amount of time? I think I see assent there. Okay, fantastic. We have a plan, and please, we have 10 minutes with you now before we go, and then we'll come back and continue with you. But we'll go right into the first round of questions, and it's a 7-minute question, starting with Mike Blasio, please.
Thank you, Chair, and thank you so much, Minister, for being here today. We greatly appreciate your input and feedback in this important study. We recently just came back from a trip where we went to Vancouver's East Side and visited a Friendship Center and UNYA across the road, the Youth Association. And then we went on to Sioux Lookout and visited a hospital and the Indigenous Health Authority. And everywhere we went, resources were the number one issue that so many are dealing with. Especially at the Indigenous Health Authority up in Sioux Lookout, the building was fairly packed, tight quarters. It was a smaller facility. It was an older facility. I mean, we were just in a brand new hospital up there, a spectacular hospital. They seem to be providing very good services. But most of the people that were there were non-Indigenous workers. But the Indigenous Health Authority is all Indigenous workers, and they were in not nearly as nice a facility. And like I said, very, very, there was you could tell there was a lot of frustration, a lot of potential burnout amongst the workers that were there. And this seemed to be a common thread, that they're burning out very, very quickly, you know, in some instances a year or two into the job. Has your organization looked at your department, I should say, looked at the numbers that we need to hire and train, to properly support, places like Sioux Lookout and Vancouver's East Side, so that we can, both as counselors, as health assistants and nursing in these remote communities.
Well, thank you very much for the question. And in fact, you actually raised a whole series of issues there, which is, it doesn't surprise me, because I think as you've been discovering this, you've come up with the list of some of the real challenges. So I think at the very beginning, you alluded to the programs themselves that are often under-resourced, and I think that's one of the realities that we're facing. And I'm not here to deny that many programs in Indigenous communities are under-resourced, and I think that's something that I'm certainly working very hard to address, the fact that in many areas there has not been appropriate support for programming, and it's something that I'm working with the department to make sure that we respond to. You talked a little bit about facilities themselves, so not just the programming, but the health, what I call the health infrastructure, which requires that facilities are available. And you may recall that in Budget 2016, for example, we were able to get investments of $270 million to help with health facilities on First Nations. That was fantastic, but it was actually only a drop in the bucket in terms of what the need is. So one of the areas that's been severely under-resourced over a number of years is having the kinds of facilities available. But then I think the bulk of your question actually related to human resources, which is certainly a part of that whole picture. So the programs are not what they ought to be. The facilities are often in need of repair or in need of building in the first place, but it's the human resources that I think is where we see some of the very serious gaps, both in terms of having adequate people available, but also training, and then if people are there to work, that often they feel overwhelmed and exhausted by the very difficult work environment that they're working on. So I will tell you that every single one of those areas have come to my attention repeatedly, and that we are working on them. I have the opportunity to speak across the country at a number of meetings that involve healthcare providers and people who work to both educate healthcare providers and health facilities. I raise the issue of Indigenous health, and particularly human resources for Indigenous health, at every single opportunity that I can. So that's the kind of thing that we're not going to fix overnight. You asked a little bit about the data in terms of how big those gaps are. Like many other parts of my mandate, we don't have the kind of good data that we should have. And so we know for certain that whether you're talking about physicians or nurses or other healthcare providers, that there are challenges both in terms of the absolute numbers of human resources that exist in these facilities, but often that is people who are not particularly trained in providing care to Indigenous communities, and very often it's the people who are providing care are not Indigenous, which doesn't necessarily mean that they are not able to provide care, but is sometimes part of the challenge. So those are all things that I'm certainly working on. I've been very impressed with the work of the Indigenous Nurses Association, the Indigenous Physicians Association. I've been impressed with the work of the College of Family Physicians of Canada and other organizations that are working hard to find ways to prioritize getting Indigenous young people into educational programs so that they will seek careers, and then we need to find the ability to make sure that they get to the places where they're needed. I hope that adequately answers your question.
1 minute remaining.
So a lot of it, what we've very clearly discovered in a lot of our witness statements all the way along, is the absolute need for long-term stable funding for a lot of these programs. Yes, it's getting the data necessary to determine the size of the problem that we're dealing with, especially from a human resources and an infrastructure standpoint. But also that one of the biggest problems that we've seen through this witness statements is that they really need to be community driven. And I don't. Do you see that? Is that how you're directing your department as well, is to focus on community-driven projects that have the type of funding necessary in order to bring them forward?
Well, I'm very glad that you brought that up because I think that it's absolutely essential that any kind of solutions that are being discussed are community driven. And again, I really want to attest to the fact that people are working very hard in these communities, and I know that the folks in the First Nations Inuit Health Branch work very closely alongside community leadership to ensure that the programs are in fact designed by communities and respond to the needs of communities. And I think that we have to underline that fact that it has to be community driven.
Thanks for the question and for the response. I had said we'd go till 3:57. It's just about 3:56 now. I think rather than getting into a new question, we'll suspend now. But before we suspend, I just want to invite the panelists to come back as promptly after the vote as possible, and the same invitation to the committee members. And thanks to members from NWAC for their patience and understanding. We'll suspend and see you soon. Okay, we're coming back from our suspension, and it looks like we have the number of minutes we're going to add to the end of the meeting is around 27.
Yeah.
So we'll go then till 3 minutes to 6.
That I can't miss.
Well, we will have to stop the proceedings for you, Mike.
No,
I'm kidding, of course. So we'll go right back to the questions then, and the next question is from Kathy McLeod, please.
Thank you, Chair, and thank you, Minister, for joining us today. And, I also appreciate the leadership that you're going to be taking later this week in terms of the opioid crisis and absolutely in British Columbia, especially a critical area that we have to deal with. So my first question is, in terms of the fentanyl deaths, do you have any sense of how many is through injection versus inhalation versus ingestion? What percentage of the deaths relate to the different mechanisms of delivery?
Well, thank you for the question, and thank you for raising this matter because it is an important one, and I am looking forward to our meetings on Friday and Saturday this week where we will discuss this. And the point that you've raised actually brings up one of the real challenges on the opioid crisis is that there is actually not the kind of data and surveillance that we would like to have, even in terms of the total overall number of overdoses and overdose deaths. Increasingly, a number of agencies are doing better at that. There was actually a report that came out today from Canadian Institute for Health Information, which gave some new information. But one of the things we will be talking about is how we can get the appropriate agencies together to get that information. So in terms of what types of overdoses, whether it's through injection, through inhalation, or through ingestion, we don't actually have really good data on that. I think it's the short answer.
Thank you, Minister. My next comment or question is, you talked about someone that you met during the summer whose life turned around with treatment. Certainly my experience is that treatment is not available or it's very, very expensive, and so that really for our Indigenous people that are having challenges, this person was lucky. They had a band member that would support them in treatment. So I think, would you, just a yes or no, you would agree that there is a lack of opportunity for people that are looking for dealing with their addiction? It's not easily available. Would that be accurate?
I think it would be accurate to say that there is a shortage of treatment facilities and programs.
My next sort of area of focus is that the health minister in British Columbia has indicated that it's important that you repeal the legislation that we have around communities and the establishment of injection sites. So again, these are going to be just a bunch of yeses or nos, because all of a sudden the communities are seeing safe injection sites are going to be the cure for these horrific deaths. And to be quite frank, I think with the data that I've seen or the anecdotal experiences, ingestion, and I don't necessarily see that people will be going to safe injection sites to, from the wedding to ingest their drugs. So I don't believe the safe injection sites are going to be a panacea for solving this issue. But, some of the criteria, and a quick question, do you believe, and it's just yes or no, that a letter from the provincial minister should be part of an application? And again, I've got to run through a number. So should a letter be part of an application?
Well, I'd like to expand and not give you just a yes or no on that. We are currently looking at the legislation around what's required in order to get a Section 56 exemption to open a supervised consumption site. And I've made it clear that for communities who need them, where they're appropriate, where there's a community desire to have those programs, we need to find mechanisms to make them more available as one of a range of tools. And of course, this is the kind of thing where there would be collaboration with the community and would be collaboration with provincial health authorities.
Okay. And I believe that there are places and times with proper consultation. Obviously, that safe injection sites play a critical role in the sort of number of dimensions. But local government, again, a quick yes or no, should local government have the ability to have some input into whether and where they have input into zoning? Is it appropriate for them to have input? As I say, I have a list. Is that appropriate?
I have always said that when we talk about the availability of supervised consumption sites, that they are a good tool available in the communities where communities have indicated that there is a need and that there's an appropriate.
So the requirement for municipal is appropriate.
Community consultation is absolutely essential.
Should the police have some input into the local police force? Have any input?
So, I mean, I'll go through the whole list with you if you like. What I can tell you, just that might shorten things off, is that there are different ways that you can get these types of required inputs, and there was a Supreme Court decision associated with supervised consumption sites that made clear a certain number of criteria that are absolutely essential. There are multiple ways that you can get that kind of input. So the goal here is to be reasonable, and the kinds of things that you're suggesting, like should local police be involved, that's a perfectly reasonable expectation, and is certainly there would be the Minister of Health has to, no matter what the rules are, sign off on a Section 56 exemption in order to make these sites available, and I can't imagine any Minister of Health that would see that it would make sense to give that exemption if there wasn't community consultation.
Yeah, so I do believe probably if we went through the list, you would probably agree that we have a reasonable consultation process, that you ultimately can use that information to make a decision, and therefore I would be very concerned if, as some of the ministers are asking, that we remove that very critical engagement with communities and municipalities and police forces as we make decisions. And again, there is a role, absolutely. We have some good checks and balances in place, and so thank you.
So I think can I just respond to that briefly?
Sure,
just to say, there are things about the current legislation that are problematic, partly in the sheer volume of work that's required on behalf of communities to document a number of these matters. But one of the other challenges that's been raised with me is the fact that I can't even comment, and my department can't even respond until this big, long list of regulations is addressed. So we need to work with communities. People are dying, and these sites save people's lives.
Thank you. So we're going to repeat again what we just did here because the bells are ringing again, but we'll keep on going again until 10 minutes before the vote, and I'll suspend at the appropriate time. So let's proceed. The next question is from Charlie Angus, please.
Thank you, Mr. Chair. Thank you, Madam Minister. Very pleased that you're here today. And I only have 7 minutes, and there's so much I want to talk about, so I don't want to sound terse. And I don't think it's an issue of talking about what's happened in the past. It's what's under your control that we can change. We lost a young man today. We lost a 13-year-old boy 2 weeks ago. We had 99 attempts in Manitoba in one community in Shamattawa. And every time I talk to people, they tell me they don't have the frontline workers. They don't have the ability to track to see if children are being protected. So on November 1st, you and all of us voted to flow that $155 million shortfall immediately. So what does immediate look like to get it to those frontline agencies?
So first of all, thank you for the question, and thank you, as I have before, on your very important work and advocacy around these issues, and I look forward to your further input and good advice. So you've actually kind of mentioned a couple of things together. One is around mental health resources and the human resources to support that, and then you've also talked about the response to the Human Rights Tribunal, because that was
flowing the money. Yeah,
flowing
the immediate.
The money.
What does immediate look like to get that money out?
Immediate obviously is as soon as the money can get out the door, and so you've heard some of the responses from my colleague, the Minister for Indigenous and Northern Affairs, but I want to say that on the matter of Jordan's Principle, which was one of the features that the Human Rights Tribunal spoke about, I'm very pleased that we were able to get funding to be able to fully enact Jordan's Principle in the order of $382 million. That has actually been very effectively used by my department, and Sunny can give you details, but at last count, we know 900 children have been assessed. So there is, the money is flowing, the work is being done, and kids are getting the care they need.
Well, according to Cindy Blackstock's, it's frustrating saying she may take you to court because you haven't implemented the full Jordan's Principle. You've implemented your interpretation of Jordan's Principle, which is short-term crisis, children with emergency needs. We have doctors who came here last year and said children were dying. We were falling through the cracks every single day because of racist, that's their terms, and discriminatory policies by Health Canada against children. They wrote to you in September and said that your policies were racist and discriminatory, and yet those policies are still in place. So you might help 900 kids who have special emergency needs, but these doctors are saying your policies are hurting kids. So why have those policies not been changed?
I think that it's important to note that there have been changes in the approach, and I think that the work that's been done to date has been helpful. I am not going to say that that within healthcare systems across this country that racism and discrimination does not exist.
No. This is about your department. So let's give you an example. We've got a 2-year-old boy. Doctor says that boy needs an audiology test, and one of your officials says it's not necessary. That wouldn't happen in any medical system in this country except under Health Canada. Do you think that that's acceptable? Why is that policy still there, that one of your bureaucrats can override a doctor's prescription?
So I don't want to respond to the specifics of a case that I don't know the details about, but I can tell you that we are absolutely committed to the full implementation of Jordan's Principle. We have put the money and the resources behind it. My department,
Okay, so the issue then is 2-year-old boy turned down for an audiology test, not by the doctor, by a bureaucrat. So if that policy is still in place, that is still discriminatory. So in terms of the denial of services to children for mental health services, or the delays where kids have ended up falling through the cracks, do you track them? Because what we hear is that Health Canada turns down or says go to Indian Affairs says go to Health Canada. Did you track those cases?
So, Mr. Angus, I would encourage you and any of your constituents and others that for whom you are advocating, and once again, I congratulate you on advocating. I don't think we do anybody any favors by blaming officials who are working very hard to address the system. That's not to say that there's not room for improvement. It's not about blame, but it's do you keep records of these children because you're responsible for them? Does your department track them? If there are specific cases, I would like you to bring those to my attention and speak to me at any time, speak to my officials.
Okay. Well, I'll give you an example because we had your chief executive director at committee, and I asked him that question. He said, of course we track. Of course. If they need service, we track that. I said, would you pass those records over to our committee so we know? Is this hearsay or not? And he said he would. So that's committee testimony is like speaking on the record. You have to be truthful. But when I asked your department said they don't track. So just because you don't track children that fall through the crack doesn't mean you're not responsible for them. So my question is how can you then make any kind of financial planning if you're not actually tracking the denial rates of children who are needing these services? If you don't track, how do you know?
It is my understanding that any requests that are made that there is a tracking mechanism to respond to those, and if there's evidence to the contrary, I look forward to hearing that. I can perhaps ask
So would you I don't need names, I just want to know what are the percentages, because I note that in terms of denial rates in special orthodontics, it's gone up to 99% appeals. Now we have that on record. Why don't we have the denial rates for children needing mental health services who are facing potential risk of suicide? Do you have it or don't you?
I'll ask Sunny if he wants to comment in terms of whether that's available.
So the access to mental health services, I believe you referred to the mental health services under the non-insured health benefit. So every individual that is a First Nation or an Inuit person have access to coverage for a certain number of sessions every year. So
yeah, I know,
in,
but
in theory, there is
people are
no,
told time and time again that it doesn't exist. So I asked your official, do you track? He said yes. Do you have the statistics? He said yes. Then I said, would you give them to us? And he said yes. So we contacted your department and we were given a letter saying you don't have any of these records. So how can you tell us that you're actually looking after these children if you don't bother to track and yet you tell our committee that you do?
if I can answer this one, we don't track denial because under this program, everybody is eligible.
So everyone's
to the
eligible, but if
section-
they don't get served, then they fall through the cracks.
But the service is coming from private provider. We don't necessarily have a tracking of if people have asked for these sessions or have seen the providers. We confirm that we will be covering the cost.
That's like a form of systemic negligence if you
I'm
don't actually know.
afraid we'll have to leave that question there. We're over now. The next question is from Michael McLeod, and then we'll have to suspend again after that.
Point of order, Mr. Chair.
Oh, you're going to take. You're going to.
I have a point of order.
Oh, please, yeah, let's.
Given the timing and given that we do have another session, I'm wondering if we could see what we can do with the NWAC guests that are here today, because I don't. It may not be appropriate to keep them and us run out of time. So I'm wondering if there's a way we can have them speak, or maybe not have them wait for another hour and come back and say we won't have time. I'm wondering if we can deal with that.
Oh,
just
okay.
before.
I have an idea for that. Minister, did you want to?
Well, I was going to say it may be easier for me to come back another time than for your other guests to come back. So if it's easier to reschedule
my
me.
proposal was going to be for committee members to consider that we've kept through the next question, which we do have time for before we have to return to our seats. That would get us through all the 7-minute questions, and that often we only get through the top 7. So we would just finish with your panel at that point after this question. As soon as we came back from the vote, we would start with NWAC. Does that sound okay? Okay, thank you. So,
Thank you, Mr.
Michael
Chairman.
McLeod.
Thank you, and thank you to the Minister and her staff for the presentation. I think you captured pretty much all that we've been hearing over the last while as we've been on this study. There's so many things. As you stated, there is no one solution, and there's so many things that need to be addressed in order to correct and change the trend that's happening all across the country. In different parts of the country, we see there's a lot of need, but in the north, we seem to see more than other parts of Canada, and that's where we're seeing the suicide rates go through the roof, especially in Nunavut and in my area, in Northwest Territories. And there's a real need for investment and a real need for catch-up. And it's the first time in many, many years that we got money for housing. You know, we're hitting a crisis level with housing. It's the first time that we got all our land claim negotiations moving again. So those things are really positive. But at the same time, we still have a lot of other things that have to be looked at in terms of dealing with the addictions, with the residential school fallout. Yet we don't have any facilities. Our facilities are lacking. Our staff, we don't have enough people on the ground. And in the Northwest Territories, and I believe in Nunavut it's the same thing, our funding comes on a per capita basis for the most parts for a lot of the programs, and really doesn't amount to a whole lot. I remember a housing program being announced, and it was on a per capita base. I think we were able to build 2 houses. So if health money comes on a per capita basis, it doesn't go far enough. We need base plus funding. Is that something you would consider as we move forward in the discussions with Northwest Territories and Nunavut and northern jurisdictions?
Thank you for raising this issue and for the work that you're doing on behalf of the people in the Northwest Territories. There are particular challenges, there's no question about it, in terms of delivery of care in the territories, and this is something that's been raised by other members as well. And so there are a few mechanisms that we have to respond to that. Of course, for health services in general, there is a Canada Health transfer, but a large part of the health funding for the territories comes out of a territorial transfer arrangement. arrangement with the finance minister as well. And in addition to that, there is something called the Territorial Health Investment Fund, which I understand has been helpful to the territories. That's something that I will be having further conversations about the ongoing nature of that funding. But we absolutely recognize the need the fact that costs are higher in the territories because of the long distances. There's actually a considerable amount of innovation now being made available in terms of delivery of care to remote locations, and that's something that I'm also hoping to find ways to support as well. I spoke last week to a doctor in Saskatoon who's involved in the Doc in a Box program, for instance, which is using remote presence robotics to support delivery of care. So there are a lot of different ways that we can support your constituents in terms of making sure they get the health care they need.
And we certainly have a lot of catch up to do. We really didn't get a lot of investment in the last 10 years, and we need to play catch up. And with the crisis happening in the area of suicides, we know there's despair in the communities. We know there's a lot of need. So I'm hoping that we're going to be able to address that through a new funding agreements. Aboriginal Affairs or Indigenous Affairs is doing a lot of refocusing or a lot of review on some of the areas in urban Aboriginal strategy. We're really at least I have been pushing hard for them to look at what's there, what's existing, how can we enhance it, how can we do better. The one piece is always that's not included is the Aboriginal Head Start program. It's something that we've heard in our visits to the communities that works. It includes language, it includes youth, yet we don't know where it's going. We don't know if it's going to be part of the discussion with the other Aboriginal programs. We've heard through the media and other sources that some jurisdictions like Nunavut and Northwest Territories also have not expanded the program and since it started, and maybe it might be better served in another department. Could you talk about if there's any way we can look at enhancing it or expanding it? We've heard about the need for family centers, cultural centers, and maybe the Friendship Center would fit the bill. Maybe the Aboriginal Head Start would fit the bill. I'm just trying to find ways that we can flow money. Okay.
So thank you for bringing up the Aboriginal Head Start program, because it's something that you and I have talked about before, and you've spoken to its power and effectiveness in many communities. I've had the opportunity to visit Aboriginal Head Start sites, and it actually responds to some of the very things that you have been talking about in this committee in terms of cultural continuity and helping people to understand from a very young age their language and their heritage. And so I think it's, from what I understand, is a very effective program. It's run primarily in two particular mechanisms, in some cases through the First Nations Inuit Health Branch and INAN, I believe, but in our case, in Northwest Territories, I believe it actually flows through the Public Health Agency of Canada, and maybe Sunny can clarify that. But in Northwest Territories, that's where the funding comes through for the program. I think we would welcome opportunities to continue to see it expand, but I will ask Sunny to speak to some specifics as to programming.
Yeah, this is...
The money goes to public health to the Northwest Territories, but the regional representative is from the Yukon. Why don't we have one in Northwest Territories? We don't have a voice outside of the MP to talk about Aboriginal Head Start because the representative lives in Whitehorse. He should be living in Northwest Territories. Is that something you can look at?
I cannot comment on that. I'm not aware about the structure, about how the funding is flowing between the agency and the recipient in Northwest Territory, unfortunately.
I would be happy to put you in touch with, or to look into that.
Yeah, because other programs are slowly gobbling up the jurisdiction for Aboriginal Head Start, and it's one of the few Aboriginal programs that we have. We're going to lose it if we don't put some more resources to it or attention to it.
I will certainly look into the details for you on that.
Thanks. We're out of time there. So we will suspend, and again, I welcome and we'll thank you very much, Minister Philpott, for your time today and for your testimony. Very valuable for us, and we'll suspend and come back after the vote and go from there. Also, could I ask anyone from NWAC is in the room? Please identify yourselves to me. Okay, thank you. So it's 5:15, and I want to just ask again, committee members, if you're willing to stay an hour till 6:15 to give NWAC a full hour. Kathy.
Chair, perhaps we could see how we do with just sort of one round, 28-minute round, with the 7 minutes.
The 7-minute round?
The 4 7-minutes, as per the minister.
Let's test that. So does that, how do people feel about getting through a 7-minute, the 4 7-minute questions after the 10-minute presentation? Okay, thank you. Okay, well, sorry, one moment. Oh, sorry, who's? Welcome very much to the Native Women's Association of Canada, specifically Lynn Gruel, the Executive Director, and Amy Nawagabo. I can ask, please, for you to guide me on the pronunciation of your last name.
Nawagabo.
Thank you. Welcome, who is the, I have the French version. Partner for Engagement and Knowledge Exchange. Thank you both for coming and for your patience and understanding about the timing today. I am going to give you the floor for a 10-minute presentation to share between the two of you as you would like. And as you probably saw in the, earlier, I have these cards, and when you get to 9 minutes, I'll show you a yellow and 10 for a red, and then we'll do a round of 7-minute questions afterward. So you have the floor for 10 minutes. Thank you.
Thank you very much. Good afternoon, Mr. Chairman, committee members, and distinguished witnesses and guests. My name is Lynn Grew, and I'm the Executive Director of the Native Women's Association of Canada. This is Amy, and Amy is a Senior Manager at NWAC, and she's also a researcher par excellence, and she will probably be able to answer many of the questions that you might have on this subject. First, I'd like to acknowledge the Algonquin people of whose traditional territory we are meeting on today. Thank you for the opportunity to present. I'm a Métis woman of mixed Algonquin and French descent. I bring with me the voices of my ancestors, the concerns of Aboriginal women from across Canada, and the hopes of our future leaders, our youth. NWAC is the national Aboriginal organization in Canada that represents the interests and concerns of Aboriginal women and girls. NWAC is made up of provincial, territorial members associations from across the country. Our network of First Nations and Métis women spans north, south, east, and west into urban, rural, on and off reserve communities. We've all read the staggering headlines reporting the high rates of suicide among Aboriginal youth, some girls as young as 9 years old. In light of these recent tragedies, I encourage you, all of you, to join me in picturing someone in your life that you deeply care for, whether it be a family member, a friend, or a colleague. For me, I envision my own daughter, a 17-year-old young Aboriginal woman, full of potential and enthusiasm for life. It is devastating to hear on the news that another one of our communities is struggling with this issue of youth suicide. The thought of losing my own daughter to suicide is absolutely unbearable. In Canada, we must act quickly and compassionately to address this urgent crisis occurring in our Aboriginal communities. We must allow the reality and the impacts of these suicides not only to touch our hearts, but to drive us to take action now. I cannot stress this enough. Every single life matters. The forced assimilation through discriminatory government practices such as the Indian Act, residential schools, the 60s Scoop, Bill C-31 have tremendous negative impacts on the health and well-being of Aboriginal people. Socioeconomic and cultural factors that contribute to the suicide crisis among Aboriginal people include, but are not limited to, poverty, unemployment, lack of access to health and social services, substandard housing, food insecurity, loss of culture, language, and the land. Many continue to suffer the impacts of these policies generations later, including my own daughter. Aboriginal women and girls, their families and communities continue to experience anxiety, depression, homelessness, post-traumatic stress, and other mental health problems and illnesses, which can contribute to harmful behaviors such as drug and alcohol abuse, self-harm, and suicide. For decades, researchers have been reporting and are reporting various high suicide rates among adults and youth in our Aboriginal communities, which are several times higher than rates among non-Aboriginal peoples. In the past year, communities such as Bearskin Lake First Nation in Northern Ontario declared a state of emergency after a series of deaths, including that of a 10-year-old girl. Then, in Pemiskama Cree Nation of Northern Manitoba, over a 3-month period, had 6 youth suicides. Attawapiskat First Nation in Northern Ontario declared a state of emergency after 100 people attempted suicide since September 2015 alone in the month of March. And the latest news reporting, Stanley Mission, La Ronge, and Deschambault Lake in northern Saskatchewan lost 5 young girls, aged 10 to 14, within a week because of suicide. These innocent children who should be outside playing and enjoying their youth have lost hope and are choosing to end their lives. For many isolated Aboriginal communities, suicide has become normalized behavior or attempts at suicide. Recently, NWAC has collaborated with Statistics Canada on an article, Past Year Suicidal Thoughts Among Off-Reserve First Nation, Métis, and Inuit Adults aged 18 to 25. Some of the key results do not come as a surprise. The prevalence of lifetime suicide thoughts among young adults was almost double, 27%, that of their non-Aboriginal counterparts, 15%. Most interestingly, Aboriginal young women in particular showed a trend towards higher prevalence of lifetime suicidal thoughts and were more likely than men to report mood and or anxiety disorders and a bullying environment in school. Research shows that high self-worth, strong family ties, strong social networks, and education can help prevent suicide in our communities. Also, research by Chandler and Lalonde, 2008, found that community and individual empowerment, control over personal lives, connection to culture, participation of women in local band councils, and the control of child and family services within the community protects against suicide. The remote First Nation of Bella Bella in British Columbia is a great model for preventing youth suicide by reconnecting the youth with land and culture. They built a youth center to run youth programming 14 hours a day, 7 days a week that focused on traditional songs and culture, hunting and fishing activities, language revitalization, and education on their history and community. There's also another Indigenous youth program, the Southern Treaty 3, that has identified 5 key priorities for moving forward. Those priorities are listed in a report, and they are the need for support to learn how to be a healthier family, and this is coming from the youth themselves. Crisis support workers, that was number 2. Number 3 was support around death, loss, and suicide. Number 4, access to elders and culture. And number 5, safe spaces. We think this is a very interesting and informative report. It's time to act on the knowledge and the need for change as voiced by our communities. We need to develop gender-appropriate and community-driven youth programs and services to help build self-esteem, self-worth, and rebuilding the connection among our youth to land and culture. We acknowledge the Liberal government's recent commitment to $70 million in new funding over the next 3 years to address health and suicide crisis involving Indigenous peoples living on and off reserve territories. However, long-term solutions, improved resources, and gender and culturally aware mental health services, both on and off reserve, are urgently needed to effectively address the crisis and the underlying systemic issues contributing to the risk of suicide and suicidal thoughts in Aboriginal youth across Canada. It is too often easy for leadership and governments to forget about these matters so long as it does not occur on their doorsteps. If Canada refuses to spend the necessary funds on Aboriginal communities, thereby denying children access to clean water, safe housing, education, and equitable health care, By doing so, Canada is essentially deciding that Aboriginal families and children matter less. This institutional form of racism allows for disproportionate spending. On January 26, 2016, the Canadian Human Rights Tribunal issued a landmark ruling that found that the federal government, guilty of racially discriminating against First Nations children in its delivery of child welfare services on reserves. The Canadian government was ordered to take immediate action to ensure its program budget responds to the unique needs of First Nations children and their families, and to apply Jordan's principle to all First Nations children on and off reserve. It has been nearly 1 year since that decision, and still the Liberal government has not adequately responded to the discriminatory underfunding of child and welfare services, and are also failing to properly implement Jordan's principle. Cindy Blackstock stated that equity in social services can reduce the tragedy of youth suicide, but still the Canadian government has not yet acted on this. Canada is a wealthy country, and our children deserve better. We must continue to work together to realize our children's potential, to help them have hope, and so that they begin to accomplish their dreams. And that requires us to take bold and immediate steps forward to create the change necessary and to make it a reality. Let's show them that we are a caring and inclusive society where the future is bright. Thank you.
Thank you very much for that. We'll move right into questions, and the first question is coming from Don Resnack, please.
So, thank you for coming today. I'm Ontario's only First Nation member of Parliament, member of Treaty 3 territory, which you referenced, and I actually worked for the organization as the executive director. Seems like a million years ago, but a while ago. And I know the problem with government funding and the way organizations, the way communities are funded. And you spoke about long-term solutions to solve the problem. And I see it right now as that First Nation people and Indigenous people across this country have been put in a place of dependency through the Indian Act. And the Indian Act was good at what it did. It made our people very dependent on someone else. And that needs to stop. And I'm not deflecting the responsibility for the federal government and the provincial governments right now in terms of resolving the problem as it exists. So we're in crisis mode. We have, you've referenced the suicides, the unacceptable suicides that are happening right across the Northwest Territories, Nunavut, Northern Ontario, Northern Saskatchewan, and right through all our First Nation communities across the country, and it's deplorable and it needs to be stopped. We've heard over and over again some of the things that you've referenced while we've been working as a committee on the study, that youth centers, starting from a very young age, are very helpful in giving Indigenous youth some meaning. And that goes a long way into preventing these tragedies from occurring. But I'm somewhat familiar with your organization, and again, I in the long run, I see Indigenous communities and First Nation communities across this country building programs to help ourselves, to help our own people. And I understand that a lot of capacity is not there in some communities. My vision would be that we have, in terms of First Nation communities, our own revenue, whether through natural resource sharing agreements with the provinces and the federal government, that we don't have to be, and I'm careful when I say this because I think some people misinterpret this sometimes, but beggars in our own land. That we've signed treaties, we signed agreements in history to share this land, and that's not what has been happening. Our land's been taken and we've been marginalized, placed on small patches of land called reserves, which are usually scrub land, and then given money from these governments and told how to run our programs and how to run our communities. So that's the long term. That needs to change. I don't have all the answers for how that's going to change, and it's going to have to come from the individual communities across this large land. My question to NWAC is, what has your organization been doing in the short term to partner with community groups and other organizations to deal with this crisis immediately? and what support can the federal government give to your organization and to other organizations that are helping with the immediate crisis?
I'll start, and then I'll ask Amy to give her comments as well. So as you know, NWAC is an organization that is advocacy. We do a lot of advocacy. We do research as well, and we've been very busy with the missing and murdered Indigenous Women's Inquiry and everything around that. So and whenever we're out, wherever we're out, we hear on the side other issues, right? This is one of the issues that we're hearing more and more about. We do have a bit of a research unit inside the organization, so Amy has been doing some research. In terms of programming or anything like that, we just simply don't have any. So at this moment, unless some specific funding was provided to NWAC, so we're not engaged at that level. At this moment, we're speaking out whenever we can, through our Facebook, through our Twitter, by doing the research and coming to forums such as this one, to be able to raise awareness about it from a gender perspective, I would say, on the issue. So.
Well, so you're not set up, as I understand it, to run programs. Do you partner with any other organizations, perhaps provide your research to these organizations to help them better tailor their programs for the specific community? Yes,
so and I'll let Amy speak to some of the partnerships we have in terms of with Health Canada and other partnerships.
Sure. So just quickly, I just wanted to reiterate that NWAC lost 100% of its health department funding in 2012 and has had no capacity to address any health issue. Luckily, in 2014, we were funded by the Canadian Institutes of Health Research to start engaging in health research and partnerships, and that's why I'm called a PEAK, Partner for Engagement and Knowledge Exchange. So basically, this funding opportunity allows us to do some work on suicide prevention and mental health. So right now, with the work that we're doing, we're able to partner with research teams that are going and doing participatory research with communities in different areas throughout Canada. Really innovative partnerships like looking at resiliency factors and through really innovative research projects like dance, theater, art, like working with the youth, working with the communities. These have been, I think, really, really fabulous research partnerships and approaches to dealing with suicide. We also engage, like with Statistics Canada. I mean, we have no funding to do so, but we partnered to do joint publications to analyze the data. We look at a lot of the APS stuff that we have, and I think we're going to be promoting the next APS as well. We partner with a lot of different organizations that work on mental health through providing feedback on their mental health frameworks for First Nations, Métis, and Inuit. I mean, it's really difficult because I'm a department of one. And suicide, and we're looking at every health issue. Well, I work on every health issue in Canada, and you know that there are many issues that are impacting our Aboriginal women. So I mean, we're trying to do more. We've recently we realized that after everything was happening, like it's hard to be able to. We're not. Although we consult with a lot of the women on the ground in our regions, I'm not in the communities myself, unless when we go and do some of our research collaborations, I get to work with the women. But so things.
I'm sorry, Amy, we're right out of time there.
Fact sheet.
Go ahead.
We've developed a fact sheet geared towards Indigenous women and girls, just to talk about where they can phone if they need help, what signs to look for if there's any kind of. Anyway, things like this are what we're working on.
Thank you for that. I appreciate that.
Thank you very much. And maybe if you could leave that behind or get us a copy otherwise. Thank you. The next question is from Kathy McLeod, please.
Thank you for coming today and your patience while we dealt with the bells back and forth. I'm going to start 2 weeks ago. A portion of our committee was traveling, and part of our travel included some youth panels, and we did a few in different locations. And And one of the most profoundly disturbing things that we heard during these youth panels was some beautiful young girls talking about sexual assault and talking about it. I think we all left those panels feeling very, sort of heavy. And this one girl talking about, then cutting behaviors. And I noticed there's also been some articles out there recently that, we need to be talking about this. And, we probably also need to be talking about this in the context of the study. So I'm just opening that up if you have anything to say. As I say, I think the sharing of these young women, young girls was, very profoundly disturbing.
So yes, when we are out there for projects, as Amy was saying, we do hear about these other things as well, including sexual assault and even human trafficking. So it's something that we're also hearing more and more about, and that we're engaging in some research on that. And they're issues that are they're very delicate and sensitive, and I think that's why an organization such as NWAC is very useful, because there is a network across the country. We do have the ability to go in and do more kinds of research and help out from that perspective. So we're happy to be called on and to use those networks when we have them available.
So it was suggested that perhaps we're not talking about this as much as we should be. Would you agree with that?
Yes, definitely. Okay. They're difficult questions, but we need to talk about them.
Okay. The other points that you made, and I know that you talked very specifically about both on and off reserve, and I know that we have, although it's far from perfect, infrastructure in terms of the on reserve. I continue to look at where the largest population live off reserve. I think it's 60% plus now. And I look at the sort of the capacity of the organizations. The friendship centers, I have the utmost admiration for friendship centers, and I see their budget is minuscule, and I see that they are regularly, having to reapply every year. Some of them have been delivering good service for a long time, and I guess in terms of the whole focus in supporting off reserve, if you have some comments.
Mm-hmm. Well, I think it's very important. It's very necessary. And again, maybe there are things that we don't talk about enough. How do we provide the different services that are needed on reserve versus off reserve? And the capacity to do that is so low. There's so much expertise inside the organization. It's historical expertise, and NWAC has been operating since 1974. There's a lot of corporate knowledge there that's underutilized. It's underutilized, and unless there's more capacity, more funding, we're talking about resources and funding. And I think we're in a unique position, and the organizations are in a unique position to help in a very concrete way. But resources have to flow there to be able to flow back to the communities in a way that we know can be very helpful. Do you have anything?
So would maybe by the time I finish in my role here, we'll have a system whereby you have organizations, and I don't have any trouble with having competitive processes, having reviews, having evaluations, but proven programs that have to reapply year after year after year, where they lay off staff and they have to, sometimes they're giving up office space. The idea of a contract of perhaps a little bit longer duration is that something that...
Thank you very much for raising that. Thank you very, very much for raising that. It is a crisis. I would describe it as a crisis. So I've been at NWAC only since November 1st. I have a long history in working in Indigenous issues, But this is my observation, that it is incredible the amount of requests that are coming in from all levels of government and from the international level. People want our opinion, they want us at the tables, and yet the structure is, the funding is not there. And the funding that is there is program funding that it's a hit and miss, so you get it one year and not the next year, and we can't stabilize the organizations, and we can't participate as equal partners if we don't have proper funding in place. To be very frank with you, this is it's a government city, of course. This is Ottawa, and the organization does not have a strategic policy unit. I mean, we talk policy. This is what we're doing. We're talking about policy, and there's no stable strategic core policy unit within the organization. The funding simply is not there. Yet everyone wants to talk to us, including, I came back from Mexico City last night. They're asking us to give our opinions on human trafficking from the American Secretary of State and the Mexican Secretary of State. How do we do that without, the base of funding that's needed? Thank you.
A couple of minutes. I probably don't have enough time, but I was interested in sort of digging into a little bit more about that, those 5 recommendations. But I understand that perhaps we can get that tabled and we'll have an opportunity.
Copy.
Yeah, thank you.
Okay, thank you. The next question is from Charlie Angus, please.
Thank you so much for being here. I have great respect for the work of your organization, Ms. Gruel and Ms. Nawagabo. Are you related to David Nawagabo?
He's related to me.
I figured as much because you're so quick on the draw. So anyways, he's a mentor to me. I'm very interested in putting the gender lens on the issue of suicide because we're dealing with issues of inequality. You've raised issues of human trafficking, sexual violence. And it's been raised a number of times, and we see it in the national media now, about sexual abuse of children leading to issues of suicide. But when I call in various areas to try and find out, talking to police, talking to the frontline workers, they don't have the data because they say we don't have the resources. So have you found that this is the problem? How are we going to protect children if we don't have the teams that can actually qualify to go in and do this work in the various communities?
There is no way of doing so. I believe this is the question. There is no way of protecting them unless there's people to do the work. So I think it's a question that needs to be addressed immediately.
Yeah. This is one of the reasons we push so hard for the government to finally be in compliance with the Human Rights Tribunal. That money, the government said, was like confetti. They didn't want to throw it around, but that's money that goes to the frontline workers who are dealing with the child protection right now in communities where we don't have those workers. So I'd like to follow up with you on that later. I'm interested, though, in the issues of what resources are there for women facing sexual violence in communities. We have the murdered and missing inquiry that's underway that will certainly raise a lot of questions. But I'm looking at the documents the government tabled at this committee. They have only planned to build 1 shelter a year for the next 5 years with nothing offered in the far north for the Inuit. So is that even close to being adequate in terms of the need of women at risk?
No, it's not even, certainly it's not anywhere close to being enough. It's nothing less than a crisis. I mean, there's services, basic services that are needed immediately. There is enough research, there is enough information. We don't need more pilot projects on this. We need adequate services immediately and the resources for that. How can we ask the women, how can we ask them to wait for those their basic human rights, their basic services? These are not luxuries. These are something that in the city people have access to, and we need those services.
Right. I was looking at the Health Canada, because we had the minister here today, and their travel policies for non-insured health benefits. And we've been flagged this by doctors about how many serious issues they will not cover travel for. But it says specifically that under no circumstances will they provide transportation for a woman from an isolated community to an interval or safe house. Why do you think government would actually identify women in crisis as something that they would absolutely not fund to get them into a safe situation.
Not sure why they would do that, but I think we would see it as a fundamental breach of human rights and a breach of services, equity and services.
Yeah. I want to go back to the issue of the child welfare ruling and the sexual predation on young children, where we just saw the BC Advocate October 2016 review of sexualized violence of children who were brought into government care, that 61% of those who were found, that they actually found, and so the numbers may be higher, but 61% were Aboriginal girls, even though they were only 25% in care. So these are children who are supposed to be made safe by the state, who are taken from their families and are subject to sexual exploitation. And then, of course, we have the examples of the ones who end up on the street, who end up in human trafficking. Can you talk about the importance of getting that funding in and what it means in this broken child welfare system, that young girls are being victimized when they're supposed to be being protected? And the cycle that leads to in terms of all the other social problems.
How critical it is to get that funding in?
Well, just in terms of, are you surprised? I mean, these are children taken from their families. They won't put the resources in with the family. They say they'll take them out and put them into foster care, and these children are being sexually abused. And we saw Tina Fontaine ended up on the street. We saw Renelle Harper, who had to leave home to go to school but got assaulted. Taking children from their homes is supposed to, the government's supposed to be protecting them, but they're being subject to this level of sexual violence.
Again, like the Native Women's Association supports Cindy Blackstock's position, and we believe that funding is immediately needed, and it's a crisis situation. It's a humanitarian situation, and the money should be put in place immediately to correct these types of problems that are happening, protective mechanisms, and I don't think there's any other way other than putting the money immediately to where it is immediately needed.
Right. I want to go to the Thunder Bay inquiry raised a lot of really disturbing, the Thunder Bay inquiry into the 7 youth who died, but issues of young girls who have to leave home at 14, live in boarding houses, who end up in conflict with the police. Some of that testimony I found really, I'm sick to my stomach to believe that girls are put in that kind of, and young boys are being put in that position. What do we need to do in order to protect children if they're having a run-in with the white police officers, if they're have to leave home to go to school? What do we need to do to make sure that they are able to live in society safely?
So I was fortunate enough to be in Mexico at this conference, and three countries, Mexico, Canada, and United States, and we have similar problems where it comes to sexual exploitation and human trafficking. And the discussion revolved around prevention, so how to prevent. So there are programs that are needed, and then also exit programs, so programs to help once a person is exiting this kind of difficulty. So again, I think it goes back to making sure the resources are there, the programs are there, prevention programs and programs, first aid programs, and programs for people to exit if they're in any kind of a sexual exploitation type of situation.
Thank you.
Thank you for that. Well, by prior agreement, we're down to the final question, which will come from Michael McLeod, please.
Thank you for the presentation. And I've had opportunity to meet with the association in Northwest Territories and had some good discussion with staff and some of the executive there. And I've heard the issue of finance or funding and resources as a huge concern. I've also heard it from the friendship centers. I've heard it from the band councils. I've heard it from every organization that deals with Aboriginal people. And that's something that needs to change. We have a crisis situation in our communities. It's estimated in the west and in the north, we have over 150,000 unemployed Aboriginal people in our communities. In some of my communities, there's up to 60% of the people not working. And we haven't had investment in housing for a long time. This year was the first year we got investment in quite a few years. So we don't have any work. And so people can't build a house. They can't provide for their children. And we don't have a housing program. We're starting to develop one now. So people don't have a place to stay. And so what's happening in our communities is an out-migration of people to the regional centers. And there's no work there, and maybe they don't, for some reason, they can't find a place to stay. So they're ending up on the streets. And we're starting to get quite a few homeless people in our regional centers and in Yellowknife, which is the capital of the Northwest Territories. And we don't have any treatment centers. We have 12 communities that have no RCMP. And the policy in the Northwest Territories, if you don't have an RCMP, you don't have a nurse either because of the safety issue. Too many instances of nurses being attacked or abused. And we know we're dealing with the fallout from the residential school in almost all of our communities. I'm one of the people that went to residential school, but all people my age and younger and all the elders all went through a residential school. So there's a lot of issues in our communities. But as the executive director from Native Women said in the Northwest Territories, there's no resources. And if there is resources, it's short term. So it's really almost day-to-day operation in a crammed, small little quarters. But we know we need to do more. And treatment centers, they're in the south. So we send our residents to the south at a very huge cost. And almost the day after, most of them are back in the communities where nothing has changed. They're back to what they were doing before. So we need healthy people, but we need healthy communities first. Maybe you could talk a little bit about what it would take to have a healthy community so we can start developing healthy people and what kind of investment we'd make. If you were now, you are now in front of us, you have the ability to make recommendations to us. What do we need to recommend to the government to do to change the situation that we're in?
I'm going to let Amy speak to some of this, the health aspect of it, but I'm going to speak to the funding part of it, the money part of it, because damage has been done through colonization, and we are living with a problem that is systemic. Short-term solutions, medium-term solutions, long-term solutions, but we need multiple layers, and we need a concrete action plan, not just research again and again. We need investment, and it has to be mapped out. And on a short term, though, there is a crisis, so that's there. The core funding for the organizations, I don't know how, I think that I think that's a crisis as well. If we're trying to fix all these problems that are systemic, who has the answers to the problems? Grassroots people have the answers. The organizations have the answers. We are there to help. We're there to collaborate. So we have to be able to do that on an equal footing. So we need that in place. But I would say that it comes back to funding short, medium, long term to get the communities healthy again. It takes money to undo, right? People need access to mental health care. That costs money. Physical care, that costs money. It does cost money, and it is gonna take time, and that's why it's over. I would say that the plan has to be made short, medium, long term. It's because if we only deal with the short term, we're definitely not going to get to the root of the problem, which is very long term. Did you want to say something?
Absolutely. What I'm going to speak to is the Fort Frances Tribal Area framework that was developed by 100% Youth on what they felt is how to get to a healthy community. And they listed the five areas on how to move forward with this, right? So the first one, need support to learn how to be healthier. Everything that they recommended under that first point was all family trips in the bush, family-based treatment programs, family counseling services, sweat lodges for family, Groups of families come together and everyone shares. Family projects. That's just number one. Oh, shoot. Number two. Basically, programs built around the cycle of life cycle, healing for families, crisis support workers, ongoing workers that don't just walk in and leave immediately, strong support systems. Support around death and loss was number three, but a safe place to go, places to talk to somebody, hobbies, activities, opportunities, volunteering. Number four, access to elders and culture. Learn more about your traditions, your language, Sundance, ceremonies. And I'm sorry, I'm just trying to get through them all, so I'm summarizing quickly. And number five, safe places, somewhere to go before crisis happens, a place where you don't feel judged, real welcoming, helpers, having pets and animals, healthy activities, crafts, friends, food, events. So this was just released in October. In August of 2016, and this was 100% youth. And I think the solutions are within the youth.
Okay.
Thank you.
Excuse me. Thank you very much. We have to leave it there. I want to thank you again for your patience and for the thoughtfulness and thoroughness of your testimony. Excuse me for a moment. Yeah, Charlie?
I want to say, Chair, under difficult situation, you managed to get us through 2 votes, and it was done extremely well. So kudos to the Chair.
Thank you for that, Mr. Angus. Much appreciated. And moreover, thank you very much. Okay, thanks. We can I have a motion to adjourn, please.